Hello, everyone, and thank you so much for your patience, and we thank everyone for joining us today. My name is Tiara Brooks here at School-Based Health Alliance. We'd like to thank you for attending today's webinar titled Quality Counts, Setting You and Your EHR Up for Success in Documenting and Reporting the 5 Standardized Performance Measures for SBHCs. Today's presentation will describe just that, the challenges related to setting up an electronic health record with the fields that are necessary to document the 5 performance measures, and then extracting data from an EHR can be challenging. During this webinar, our presenters will discuss challenges and strategies to overcome them. We will draw on lessons learned from participants in our learning collaborative and have an opportunity to ask questions at the end. But before we begin, we have a few housekeeping reminders. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any part during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Also, visit School-Based Health Alliance for additional archive webinars for topics such as the ones you are currently viewing on your screen. Now I'm going to turn it over to my colleague, Haley Love.
Good afternoon, everyone, and thank you so much for joining us this afternoon for this webinar. My name is Haley Love. I'm the Director of Research and Evaluation at the School-Based Health Alliance, and I want to welcome you and thank you for joining us. So this is the second webinar in our series about the School Health Services National Quality Initiative and Quality Counts. This is our initiative that's challenging the school-based healthcare field to adopt and report the first ever set of standardized performance measures for school-based health centers. The first webinar, which can be found on our website, described the 5 performance measures, how they were selected, and some of the promising strategies for adopting them. Today, we're going to be presenting the second webinar in the series, which is all about electronic health records. Now, I have to tell you that we're kind of winging it this afternoon. Right now, Lynn, who was meant to be our second presenter along with Maureen Daly, is not on the webinar yet, but Maureen and I are going to do our absolute best to present the information and to answer all of your questions, but we'll absolutely have the opportunity to work with Lynn, who has expertise in this area, to share some more information and help with questions that you may have. We'll start to address those questions at the end of the webinar, and we will have more opportunities after that. So I'm going to start off presenting some background information, and then my colleague Maureen Daly, who is a clinical QI consultant based in Colorado and a consultant for the Colorado Department of Public Health and Environment SBHC program, will share some of her perspectives as well.
Haley, this is Maureen, and I think Lynn is trying to get on as we speak.
Oh, that's great. All right. Well, hopefully Lynn will join in and winging it, and she will.
Hey, Haley.
Oh, hey.
Haley, this is Lynn. I can't get the webinar live, but I'm on, and I can pull up my copy of the slides, so we can do it that way.
Fantastic. All right, so I will share the objectives, Lynn, and then I'll turn it over to you. So
Okay.
our 3 objectives today for this discussion are to describe why a set of standardized performance measures is essential to strengthening and sustaining SBHCs, understand basic EHR terminology and how to speak to your vendor and IT support, how to sling the lingo, so to speak, and how to identify 3 potential solutions to data extraction. Knowing that there probably may be more than 3, but we'll help you and start you off in the right direction. So Lynn, I'm going to turn it over to you, and maybe you can just let me know when you're ready for me to advance your slide.
Okay. So this is Lynn Buck, and I'm a medical director with a large FQHC here in Colorado. I've been with school-based clinics for 16 years. And so one of the things we wanted to talk about is, why go through all this? And, there's a few things that are happening within healthcare now, and will be changing the way a lot of us are billing and the way a lot of us are seeing our patients. And one of those is the upcoming change in payment reform. And so right now everyone's paid on a fee-for-service. And part of the Affordable Care Act was to actually encourage prevention and look at population health. And so we see these data measures as an opportunity for school-based clinics to begin to go down that road and to look at more outcome-related data rather than specifically numbers seen, because eventually we will be paid on outcome data. And the other thing is to look at populations. So if we think about populations, a population could be, there's a population of a city or a population of a town or a population of, if you have a large clinic, all the patients that come to your clinic. But I like to encourage the school-based clinics to really start thinking about the school in which they are at is a population. And when we start to look at population health, how can we as school-based clinics affect change within an entire school, within that entire population, even though not all those students may be maybe even coming to your clinic. And that takes a lot of collaboration and working with other entities that we might not have been used to working with in the past. So I think those are a couple of things. And then one of the other things is, and we're going to talk about it later in the webinar, is how do you make yourself indispensable to your medical sponsor? And because all the medical sponsors are going to have to change over to a performance pay system and moving away from fee-for-service, and everyone is going to be working on population health. So we'll talk a little bit later in the webinar about how do we as school-based clinics make ourselves indispensable in this new arena. You can go to the next one, Haley. No?
Okay. It should be up there for you.
Okay, so I can't see the webinar. So tell me which slide we're on. I know this is
inconvenient. We're on why measure performance.
Okay, we just talked about population health, and
so I think you actually already spoke to this in terms of how to demonstrate to that your SBHC is a leader and how to make yourself indispensable. So
right, and we're going to talk a little bit more later as we go through what the data is and what that looks like to be indispensable to your medical sponsor.
So I've advanced to 2 web resources that Lynn has recommended. I don't know if you want to speak to those, Lynn.
Right. So the first web resource is a resource that talks about population health and payment reform. And I think that, when attendees have time to look at that, you'll find it really helpful. And it'll give you more in depth of what's coming and what to expect and when it might be coming. The other is an article around big data in healthcare. And those of us, who've been in practice for a while, may remember back when we didn't really have, big data in healthcare was something totally different. But now data is what's running healthcare, and it's going to be running healthcare more and more. So I think that, those are two really good articles to take some time and look over. And then the other thing is to know that as far as payment reform, it's happening in stages, and some states are going to be further ahead along on this road than others. Colorado and a few other states have agreed to be in the forefront and are working with HRSA to actually, begin to develop payment reform within their state.
Great, thanks, Lynn. Maureen, I'm going to transition to you now.
Sounds great. Hi, everybody. This slide is likely very familiar to most of you. This lists the 5 core standardized performance measures for school-based health centers: the annual WellChild visit, annual risk assessment, BMI screening, nutrition, physical activity counseling, the adolescent depression screen, and chlamydia screening. And the Alliance is going to be asking all school-based health centers starting next summer to report these measures. And so to do that, it's a good time to start thinking about what data needs to be collected and how to extract from your electronic health record. Next slide, Haley. So as per the 2013-14 census that the Alliance does, 87% of school-based health centers are now using an electronic health record. And I imagine that's going to be even higher with the next census. And as we begin to talk about collecting and extracting data from your electronic health record, it's helpful to be familiar with some terminology that is likely a review for many of you. First terminology I want to talk about is CPT codes. And this is a widely accepted medical code set that's used to report procedures, medical, surgical, diagnostic services. There are thousands of CPT codes, and they describe anything from a WellChild visit to a nebulizer treatment to wart removal. The next term is ICD, or diagnosis codes. Again, you're probably all very familiar with this. These are a set of medical codes used to actually report the diagnosis or a patient's illness, injury, or even the service they receive. And there are specific ICD codes for sinusitis, an ulnar fracture, being overweight, etc. Demographics, you all are familiar with that. That's information like date of birth, gender, race, ethnicity that's entered into an electronic health record. These last 3 terms may be new to you, and these are terms Lynn is going to cover in detail shortly. But discrete fields, observational terms, and free text are just 3 ways information can be entered into the electronic health record. And the important takeaway at this point is that the information that you enter into an electronic health record as a discrete field or as an observational term is searchable, and thus you can analyze it. So you can take all the data that's in your EHR and pull these type of fields from it. For example, CPT and ICD codes, you can search how many times these codes are used among your entire client population. Information that is entered as free text or narrative, that's what's typed into the visit note, it's not searchable. So you can't query, and therefore it's not available for analysis. An example of free text would be the details of the history of present illness. 5-year-old child has had a runny nose for 5 days, that sort of thing. You're not going to be able to pull that from the EHR. Sexual activity is another example, and we're going to come back to this later, but there isn't a specific code that indicates a client is sexually active. Next slide. So the Quality Counts Measure Dictionary can be found on the Alliance's website at the link there, using the link there. You can find within the dictionary the definition of each of the 5 core measures, and also it provides some suggested CPT and ICD codes that can be used to capture aspects of the measure. For example, next slide, the annual WellChild visit. In the Quality Counts Measure Dictionary, the annual WellChild visit is defined as the percentage of unduplicated school-based health center clients who have had at least one comprehensive well care visit with a primary care practitioner or an OBGYN practitioner during the school year, regardless of where the exam was provided. So I've listed the CPT and ICD codes that can be used to capture a WellChild visit that's actually done within the school-based health center. Likely these are codes, particularly the CPT codes, that you are already using so that you can bill for the WellChild visit that you provide. And then I listed some ICD-10 codes as well. Next slide. But the definition of this measure states at least one WellChild visit regardless of where the exam was provided. So the question arises, how do you capture a WellChild visit that is done by an outside provider when there's not a specific code for WellChild visit done by outside provider? And for many of you, this will be challenging information to obtain, but it's just vitally important information to get in terms of care coordination, in terms of decreasing duplication, and in terms of reporting to other payers. This is a HEDIS measure. Next slide. So on this slide, I've listed the aspects of the 5 core performance measures for which there is recognized CPT, ICD codes, and therefore you should be able to easily collect this information in your EHR, providing your providers are using these codes. We encourage you to start reporting to the Alliance where you are, so with what you already have, and therefore you may not be able to report everything for every measure, but you can start with what you can report and build from there. And that's what we've been doing in the COIN. WellChild visit done at a school-based health center. There are standardized codes for this, as I've already mentioned. BMI, nutrition, physical activity counseling, adolescent depression screen, chlamydia screen, and maybe even annual risk screen in your state. In Colorado, we actually don't have a specific code to use for annual risk screen, but some of you may. Next slide. Now these are the aspects of the performance measures for which there isn't a specific CPT or ICD code, and so other ways to collect this information will have to be figured out. And that includes WellChilds done by a non-school-based health center provider, an annual risk screen, unless you're a state that has that code, depression follow-up plan. So with the depression measure, it's both was a screening done, and then for those who screened positive, was a follow-up plan documented. Sexual activity, to determine the number of clients who are sexually active. And that's important because the measure is number of clients who are sexually active who had a chlamydia screen over number of clients who are sexually active. So to get at the denominator of that measure, you need to know what's the number of clients that are sexually active within your school-based health center. Lynn is going to describe how her organization is capturing this information for which there aren't specific codes. Lynn?
Great. Thanks, Maureen. So one of the things I think that us as clinicians kind of struggle with is how do you talk to your EHR vendor or your internal IT support, because it's a whole different language than what we talk, and they're not clinicians and they don't work in the clinic. So we're going to talk about how do you capture this data and what kind of things do you ask for in order to have your EHR be able to gather the data and have it extractable. So the number one thing is how do you convert free text into data that you can extract and query? Because as Maureen said, you can't run data reports or Excel or anything on free text. It's great, but it's not retrievable as a data point. And all of those items that are in the quality measures that do not have codes, right now, a lot of clinicians are free texting those. Is the client sexually active, yes or no? Where did they get their last WellChild check? Oh, at Nurse Practitioner Smith, in such and such city. So those are the kind of things that we had to figure out how do we get to those data points. So this is going to be a little bit of IT talk. So when you talk to your IT people or your vendors, what you're going to ask them for is you need a discrete field for some of these. And a discrete field is finite. So in data extraction, it means that it could have a yes or no could have a number assigned to it. One could be a 1 and one could be a 2. But it's a finite answer. It's either yes or no. There's not a multitude of possibilities. Your depression screen scores, there's a finite number there. And again, the number of mental health follow-ups, those will be finite. So so what you're going to, and we're going to go over some views of what it looks like to have discrete fields. You can go to the next slide. So the other is to create an observational term. Now, an observational term is on a continuum, does not have a numeric value to it, and there's not a statistical reference. So where was your last well exam? It could be, a multitude of answers. And being able to enter all of those, you can actually have them create a space for observational terms where you could essentially free text into it, but because of where it's located in your EHR, each one of those becomes an extractable point. And you would be able to see like 20% of our patients are getting their WellChild checks done at such and such, XYZ clinic. Because you would have that entered into your EHR as a capturable observational term. Next slide. So this is a view of a WellChild question for a school-based clinic where we're asking where was it done. So what we did is we asked our IT to create actually both. There's a discrete field and there's observational terms here. So is this a visit, a WellChild check, yes or no? That's discrete. There's only those two answers, yes or no. And then did they have a last WellChild check in the last 12 months, yes or no? And then the location, you can see right now we have a drop down that says MCPN, which is our entire organization, and then other, which is actually looks like the Smith bell. But you could have an entire list of possibilities, or you can also even free text into that field. And then our IT department, or you could actually talk to your vendor, would be able to run you a report of all the patients that you saw and run you a report. Did they have a WellChild check in the last 12 months? Where was that last WellChild check done? So that is a demonstration of both discrete field and observation terms around WellChild checks and location of completion. Next slide. This is a really busy screenshot, but this is where we actually enter all of our depression results when we're for patients who are not on the ESHQ. So in this location, you can see you have a current score, positive or negative. Obviously, that's a discrete field where the PHQ score goes, and the 2 score and the 9 score are discrete fields. And then you can't, the drop-down isn't showing, but the severity assessment is there, and you can actually click whether, depending on the score result, what the severity assessment is. And then what you see in the next section is actually the CRACK, which is the substance abuse assessment. And this is also considered a risk assessment. So again, these are all capturable. The score itself is a discrete field. The actual interpretation on this is a discrete field. But then if you look all the way down at the bottom of the screenshot, and hopefully you can see it, there is options for mental health referral, whether they were counseled, if they had a positive CRAFT score, if they were counseled on substance abuse, prescription was given for depression, in-house arrangement for them to see the behavioral health professional. So all of these actually come out as capturable and come out as observation terms. And there are ways when you talk to your vendor, if your vendor is going to do this for you, to tie those into orders. So you can ask them to add buttons for you so that you can just click it, and you can see it says add these referral orders. So for us, we just click that and it automatically adds those to our referral orders. Next slide. Sexual activity is another area that you know, we need to know what's our percentage of sexually active adolescents who are getting screened for chlamydia. And the thing is, we need to know how many do we have that are sexually active, and there is no diagnosis code for sexual activity. It's a normal function of life. So are you sexually active, yes or no? Again, that's a discrete field. And then what we have in those drop-downs are actual questions. So if they answer yes, then you click the drop-down and it will have you know, vaginal, anal, oral, or combination. And then, so those are more observation terms. Then under chlamydia screen, the drop-down is to order it or not. And then we automatically HIV screen all of our patients at age 16 and up. They get it done once in their lifetime unless they are of a high-risk population. And so then that's a drop-down, and then we just automatically order it. And then we have a question if they're interested in information about birth control. So, and then again, if they're interested around birth control, that actually is a discrete field, and so that's capturable. And then, you know, we can also capture how to, you know, was that information offered. Next slide. So I think that one of the important things is to start where you are. So as Maureen said, there's a lot of data that you already have. You already have your demographic data. You already have your encounter numbers, and you already have your unduplicated users. And then, you know, you have your diagnosis codes and your CPT and procedure codes. So, you know, start there. And then, you know, making sure that the CPT and the ICD codes that you need are easily accessible in your EHR. And this is where if you're working with a vendor and you don't have an internal IT, this is where you really need to have someone to sit down with them and explain to them these are the codes that need to be loaded into the EHR. Not all EHRs come loaded with all the appropriate codes or all the codes that you're going to need. And sometimes you have a ton of codes that you actually don't need. So being able to have someone within your organization or on your team who can sit down and talk to your vendors with that information. The other thing is you really need to talk to the providers and make sure that they're knowledgeable of what the correct CPT and ITCD codes are to use for the performance measures and how to do them. You know, how to, where do I click? You know, what's the box to make sure that we're capturing this? The thing is, you know, a lot of us, you know, most of us do all of these kinds of things, but we're not very good about capturing the data. And this is really about capturing the data and demonstrating what's actually going on in the school-based clinic. And then after you kind of work through those kind of things, then start to look at discrete fields and observational terms that are important to your agency and funders. So, you know, so a lot of organizations are involved with accountable care organizations, and that's part of payment reform. So, you know, what are their key performance indicators? What are things that are important for them? Because as a school-based clinic, oftentimes you have the ability to implement change really rapidly and do quick PDSAs and tweak things, where then you can demonstrate that process to your funders and to your medical oversight, and then they can actually utilize that information to spread it within their other sites if they have other sites. So it's really important to know what's important to them. So, you know, KPIs, the other is UDS measures, which is the Uniform Data System, and anybody who's you know, associated with an F2HC or a community health center, they all have to report UDS on an annual basis. So getting to know, like, where your organization is at on its UDS measures, what measures are they falling behind on, where are they having to stretch, and leveraging your ability as a school-based clinic to help them meet those measures. Next slide. And then, is this where the poll is at?
Yes, this is the poll question. Tiara, are you able to pull that up?
So we're going to ask you to share which best describes your situation. Is it, I'm a part of a system with IT support and we can report the performance measures? I'm part of a system with IT support and we've been unable to report the performance measures. I'm part of a system with no IT support, or other. We're going to give you about 10 more seconds to reply. All right, so it looks like 49% of you are a part of a system with IT support and can report. 20% are part of a system with IT support and haven't been able to support. 7% have no support, and 24% report that they are other. Perhaps we can get into the other later in the webinar as well. But Maureen, I'm going to turn it over to you.
Actually, this is Lynn's going to talk about this scenario A.
Oh, excuse me. Lynn, take it away.
Yep. Okay. So in scenario A, so let me just say that for the 49% of you who have IT support, you're part of a system with IT support and you're able to report on the measures. This is awesome. And kudos, and, you know, keep going down that road and keep those communication lines open with your IT support. know that that you can also use this information again to be a model within your organization and to be indispensable. So scenario A is you have a school-based clinic and you have IT support, but you've been unable to report the performance measures. So in this scenario, next slide, you really need to make the case with your medical sponsor, whether it's a large sponsor or a small sponsor. So having a sit down with them and knowing their data reporting priorities. And, you know, the thing is that a lot of medical sponsors have a lot of data reporting responsibilities that are very adult focused in the adult world. So you have to help them come to pediatrics and adolescent care and look at what those measures are that that they could excel at in this department if they utilize your scores. And you could show them where you could improve their overall scores. So one, knowing what their data reporting priorities are. Who are they reporting to and what do they have to report? And this shouldn't, none of this is really secret. They should be readily able to share this information with you. And then looking at those areas and knowing what the performance measures are that are easily capturable. So all those ones that have data points, not having to get into the observation terms and the discrete fields just yet, but looking at all the codes that are already readily available. And, you know, having a sense that, you know what, if you had IT support, you could demonstrate this to them. And helping them to see that the return on the investment is large. So again, as we continue to come back to payment reform, it's going to be dependent on the scores. So whoever your medical sponsor is, they're going to be very well aware that payment reform is coming, and that having good scores is going to improve their payment, their billables. So the other is being willing to be the index site. And I spoke about this earlier, school-based clinics, because of our small nature, we're able to make changes pretty quickly, and we're able to do a PDSA. I know within our school-based clinics, so we have 3 school-based clinics. We have 5 clinicians that work in the school-based clinics, and then we have our support staff. But we are honestly small potatoes in the larger organization, of which has 24 sites, and some of the sites are massive. But we've been able to make changes within data collection that we were then able to demonstrate that these could also spread to all the other sites who are seeing children and adolescents. But you have to be willing to be the guinea pig, and sometimes that takes a little bit of extra time, and sometimes it takes a little bit of willingness on the part of your medical sponsor to say, hey, let's let the school-based clinics try this out, and to be able to have the larger organization learn something from the smaller sites, such as the school-based clinics, and be able to then spread that to their other sites. Next slide. So some tips for communicating with IT and support data team members. You really need a clinical quality lead, and I kind of assume that probably most of the people who are on the call are their clinical quality lead person, or closely related to that person. Really becoming best buddies with your internal data analyst, if you have one. They are, if you have a data analyst, they're worth their weight and time in gold. And the more that you can sit down with them and explain what your measures are and how you need them collected, the better they will be able to gather the data out of your EHR. And the other is, your EHR vendor or the representative from your EHR vendor. Every vendor has reps and has staff that are really, their job is to meet with the people who are utilizing their EHR and how can they best serve you and support you in getting the information out of the EHR that you've put into it. And again, utilizing the measures and being able to sit down with them in a meeting. And I would really encourage face-to-face as much as possible. If they're not in your region, definitely being able to do more like a conference call. Less email is better because it just gets misconstrued. So, and sometimes this takes time to be able to have these conversations and come to a joint place. The other thing is reach out to other people that perhaps that aren't even in your organization, but who are really kind of good at this stuff, who are kind of data geeks. Reach out to people at universities, interns, finding resources. There's oftentimes people out in the field who are more than happy to donate some of their time to look at, your system. You can do this without having to compromise HIPAA. You don't have to share any patient information, but helping them to understand what you're looking for, and they can also help you to learn how to get the most out of your EHR system. And Maureen, I think you're taking scenario B.
Yeah, so scenario B, 7% of you noted you're part of a system with no IT support. And I like Haley, am very curious what the other is, so if you can type that into the comment section, we'd be real curious to know, and hopefully this information can be useful to the others as well. But I'm also agree with Lynn, 49%, that's fabulous. That's really, really great that can already report it. So if you are part of this scenario, I just want to talk briefly about a couple of ways to help with data extraction. Next slide. The first way is to actually work with your vendor or your VAR, the value added reseller, to create a customized report. So, most, probably all electronic health records have built-in reports that can be run, but these reports don't necessarily include all the information you want or need to report on the measures, or it's in multiple reports. In Colorado, we have a couple of examples of where school-based health centers worked with their vendor to create a customized report so they could use that to extract the data. And cost is always a concern. For one of these school-based health centers, it cost a couple of $1,000s. Another one, it was closer to $3,000. So it's not cheap, but it's also hopefully doable. At one of our sites, they found they were using the same electronic health record as some other school-based health centers, so they all got together and pooled their resources to cover the cost. So that's another option if you're using the same EHR and have the same vendor. Once the report is built, you can then query it, specifying a date range, and then export that data to an Excel file for analysis. And I have outlined in detail how we did this in Colorado, including some information about specifications for the report that you should talk to your vendor about, and also some HIPAA considerations. I'm not going to go into it now, it would take a long time, but if you're interested in learning more about working with your vendor to develop a customized report, please feel free to email Haley, and she will share this write-up. And if you have any questions, you can always email me with questions. I might not know the answers, but I could probably find them for you. Next slide. just as an FYI, these are the fields we asked to be included in our customized reports that we had developed. And you can see this is all information that's available within your EHR already. The last field was other discrete fields or observational terms, as Lynn has already described, that you may create and then want to have it part of your customized report. Next slide. So the second way to help with data extraction besides the customized report is actually to build your own internal capacity by having one of your data savvy staff take advanced electronic health record training. You know, I don't know that these health records, working them are rocket science, but having someone who's got a proclivity to data and to computers, I think is very helpful. It's less intimidating for that person. And also, Excel expertise is important for that person, as well as then they're going to need to export the data into an Excel spreadsheet to analyze the data. So we wanted to leave ample time for questions and answers, and so I'm going to turn to Haley.
Thank you so much, Maureen and Lynn. Before we get into the questions, I want to invite and encourage you all to join our next webinar in this series, which is called State and Local Perspectives in Promising Strategies for Documenting and Reporting the 5 Standardized Performance Measures. It is scheduled for Thursday, November 17th at 2 p.m. And our presenters will be participants in our learning collaborative, individuals who across the country in 4 states have been adopting and reporting these 5 performance measures through a learning community. They're going to share some of their ideas, thoughts, and perspectives on their successes and challenges in doing this work, what it means for the field and what it means in practice at the local level. Here is Maureen and Lynn's contact information, and I will type my email address into the chat box so that you can contact me as well. So we're going to open it up for questions now. If you can type your questions into the chat box, that would be great. And we'll start to address them. So the first question that's in here is, from where were the 5 standardized performance measures derived? And possibly a second question is, we're looking for a common EHR data collection software that would be user-friendly for our nurses in various school systems. Our large health care organization currently uses eClinicalWorks for provider visits and billing, but I don't think it will work well for nurse visits. Any suggestions on what software or database is being used by other school nurses? Okay, 2 great questions. The first one is about where were the 5 standardized measures derived from. I encourage you to watch the first archived webinar, which describes in detail how the school-based healthcare field participated in a Delphi process, which took about 6 months, where they examined measures that are part of national child quality measurement frameworks like CHIPRA, HEDIS, and Meaningful Use, and decided which measures would be most meaningful to the school-based healthcare field to help tell our story. So our 5 measures derived from that process. These measures really reflect perspectives of stakeholders in the field and what they feel is currently most important. So the second one about an EHR system used by nurses, Maureen or Lynn, do you have any thoughts about that question?
So I would say that you know, eClinical should be able to do that. I mean, we use Centricity, but you know, which is another large EHR system, and we have visits that are actually within that organization, but could be, anywhere. And I think it's just really looking at what templates are available. So talking to the vendor and seeing what they have available that you could drop in to the EHR system that you're currently using. Because the thing is, big organizations, so primary care organizations will buy the EHR for primary care, but that doesn't mean that there aren't other templates that could be added in if you need to use them. So, like in a in a school setting for the school nurse.
Yeah, I don't have anything else to add on that. I've heard that before, though. I've heard others wish there was something good for school nurses.
We can do some research with our partners at the National Association of School Nurses and ask them what types of systems school nursing programs are using, and come back to you with a response. So the next question is, do the patients, and Lynn, I guess this one is for you, it's specific to the craft. Do the patients enter their answers to the craft, or is it entered by the staff?
So, so if the patient is not, we have two systems. So if it's not done on the iPad, and if it's done on the iPad, the adolescents do the craft themselves. So they do it all, and then our support staff enters the results. And if it's not done on the iPad, then the patient does it on a piece of paper, and then our support staff enters it.
Okay, thanks.
So I should probably add just a little more that Lynn's referring to the iPad. Many of the school-based health centers in Colorado are using what's called the Electronic Student Health Questionnaire that Apex Evaluation developed out of New Mexico. I know there's other school-based health centers that use the RAPS, but it's in a way for adolescents to take a risk assessment on an iPad, and then with the ESHQ, and a report is immediately generated for the provider. So just FYI on that.
Thanks, Maureen. So we have a couple of people who shared some feedback to the poll as to what their other category meant. One has said, we have IT support, but they have difficulty pulling our data. Other says it represents the Office of Public Health Manager. Another said they're supporting the development of the SBHC as a third-party facilitator, so we're not at the point of collecting or extracting data yet. Another says we've only reached out recently to our EHR vendor or IT support about creating discrete fields, so I don't know the outcome at this time. The next question is there a master list of codes used for all of the 5 measures? So this is a great question, and we encourage you to go to our website and under resources click on quality counts. And under quality counts you'll see the 5 performance measures, and Maureen alluded to this earlier. If you click on that link to the 5 performance measures, you'll see the definitions of the measures and our recommended codes. This is not a master list, but these are codes that we recommend using for the 5 measures. And we're updating them on an ongoing basis.
And there can be some variation state to state with your state Medicaid office, but I think the list on the Alliance's website is a good list.
The next question is, when are sponsor or agencies required to submit these performance measures, and is there a form to submit them or to electronically submit? That's a great question. So in the winter of this year, sort of January, February of 2017, next year, the Alliance is going to invite interested participants to practice extracting and reporting this data. We'll open our national data portal and keep it open for about a month, allowing the field time to practice reporting this information. What many participants in our COIN and people across the field have found is that it takes practice. All of this takes practice, particularly the extraction of the data from the electronic health record. So if you have an opportunity to extract it before you wait till the full year, you're likely to see things and identify challenges that you can overcome earlier rather than later. So you'll have that opportunity to practice in January, February of 2017, but then we will invite the field to share data at the end of the school year, probably September, October of 2017, because for many people it takes a little bit of time to aggregate this data, etc. So that's the timeline for sharing this data with the Alliance. So the next question is, I work with Marshall University School Health Technical Assistance Center in West Virginia. Due to the difficulty in getting data from SBHC EHRs, we've created a couple of different online programs to capture data for special projects. One captures oral health and has been used since 2009. Another is an adolescent self-management program with 3 surveys that the student can complete. One asks questions on nutrition and exercise, craft, and the last risk assessment. This program exports into Excel for further analyzing. So this is from Stephanie Montgomery. And Stephanie, this is great. This sounds fantastic. And if you think it could be a resource for others in the field, we would love for you to share more information with us so we can provide those resources to the field. We are, in addition to the ICD-10 and CPT codes, we're constantly updating our Quality Counts website with strategies from the field that people are finding are working. So anything that you have that you would like to share with your colleagues across the field, we would love to highlight and share on our website. Okay, so we're running out of time, but we have a few more questions here, so we're going to keep on going for the final 2 minutes or so. Is there any discussion about SBHC participation with regional health exchanges or health information exchanges for care coordination, etc.? I'll answer that quickly and say yes, and I'll let Lynn and Maureen perhaps expand upon that, but many school-based health centers are using their regional and state health exchanges, particularly to identify which patients have received a WellChild visit outside of the school-based health center. So they're getting information about EPSTD WellChild visits through the Medicaid data. And we encourage school-based health centers to explore that option to identify that data. But Maureen and Lynn, anything else you would share about school-based health centers and regional or state health information exchanges?
Yeah, this is Lynn. We actually just started, we just learned that we will have that ability through our health exchange, through our ACO. And they can then run the data. They run it on the billables, so we can then know, like, if a child had a well exam anywhere within the last 12 months, and then it actually you actually get credit that it's done. The other thing is it helps to prevent duplication of services. And it's a cost reduction because it makes no sense for all of us to be, doing repeated WellChild checks when they're not indicated. So it's a really good partnership, and I would encourage all school-based clinics to learn who are your ACOs and retros in your area, and if you have a medical sponsor, find out if they're affiliated with them. If they're not, certainly encourage them to have it to get that affiliation. And then if you don't have a large medical sponsor, there's no reason why your school-based clinic can't partner and become with the ACOs.
Great. Thank you. All right. So I want to thank everyone for joining this afternoon and also being flexible with us. We appreciate it so much. We want to encourage you to become a member of the School-Based Health Alliance. You can find information on our website. And we want to invite you to submit an abstract to our 2017 convention, which will be in Long Beach, California. Thank you, everyone. We hope you have a great day, and we look forward to seeing you on our next webinar. Bye. Thank you, Lynn.
Bye.
And thank you, Maureen. Bye.